The United States Department of Housing and Urban Development, HUD, describes coordinated entry as a consistent, streamlined process for accessing the resources available in the homeless crisis response system that ensures that the highest need, most vulnerable households in the community are prioritized for services, and that the housing and supportive services in the system are used as efficiently and effectively as possible. Before coordinated entry, our response to homelessness was very project-centric, and individual programs, often with high barriers to entry, arbitrarily decided which people they would and wouldn't accept as clients. Coordinated entry shifted the homelessness response to one that is person-centric and based on community-level standards for referrals and program entry. Coordinated entry also ensures that scarce homelessness resources are triaged based on community-determined rather than project-determined needs and priorities. This move to a person-centered, community-level homelessness response is meant to improve on the previous approach, which often caused the people with the most barriers to stability and the highest service needs to be excluded from homelessness programs altogether. And as continuums of care, COCs, have begun fully implementing coordinated entry, we have seen that this shift is working and that vulnerable people who previously languished on the street for years and other people with high barriers to stability who were often rejected from programs are now accessing permanent housing resources like never before. However, given the overrepresentation of racial and ethnic minorities among people experiencing homelessness, which is caused by historic and ongoing structural racism, it is important that communities examine their data to ensure that their coordinated entry processes are not perpetuating racial disparities. Because coordinated entry is about so much more than a single assessment tool or score, communities should examine the entire coordinated entry process to determine where biases might be introduced into the system. To that end, the National Alliance to End Homelessness has developed a simple flowchart to provide some considerations that COCs should be making as they implement coordinated entry to ensure that it is equitable. And this presentation is meant to support the use of that flowchart, which is available on the Alliance's dedicated Racial Disparities webpage. The flowchart and presentation do not cover every possible way that biases could happen during coordinated entry, but they are meant to serve as a tool to conceptualize the flow of coordinated entry processes and where disparities might occur. This kind of broader, deeper analysis of the entire coordinated entry process for potential for bias is even more important during public health crises like the coronavirus pandemic, because people of color are not only more likely to experience homelessness, but also to die from COVID-19. So the imperative to ensure equitable access to the life-saving resource of housing is even greater now. The first thing to consider when thinking about ensuring an equitable coordinated entry process is what happens the first time a person experiencing homelessness comes into contact with the crisis response system. This may happen as a result of the person reaching out on her own or as a result of an outreach worker connecting with her. And there are considerations to be made in each case to ensure equitable outcomes of that initial contact. First, in the case of people experiencing homelessness contacting the crisis response system themselves, COCs must consider the level of comfort and accessibility people in low-income communities of color will have in accessing whatever system-wide intake mechanisms the COC has established. A wide variety of options should be available, including via the internet, telephone, and in person, to ensure that everyone experiencing homelessness has a means of access that works best for them. Additionally, all the means of access in the world won't help if the people who need help the most don't know they exist. So COCs must make sure that people in low-income communities of color are aware of where they can call, log in, or visit when they are experiencing homelessness. Another way that people experiencing homelessness come into contact with the crisis response system is through street outreach. Street outreach is a vital but woefully underfunded resource for connecting with people experiencing unsheltered homelessness, who we know from decades of research are more likely to be experiencing a multitude of mental, physical, and behavioral health problems, and to be more exposed to violence and other negative outcomes as a result of living outside. But we also know that our street outreach programs may not be connecting with people of color experiencing unsheltered homelessness in equitable ways. To ensure increased trust between street outreach workers and people experiencing homelessness, communities should make sure that workers are racially, ethnically, culturally, and experientially reflective of the people being reached out to, and that workers of all races and ethnicities have been trained in cultural humility and cultural responsiveness. Additionally, communities should think about where street outreach teams are conducting outreach. If outreach is primarily being conducted in places where predominantly white people are unsheltered, unsheltered people of color are necessarily being missed. Street outreach should be extended to communities of color, and people of color experiencing homelessness should be consulted when designing street outreach programs to ensure that street outreach workers know where to connect with unsheltered people of color. A next step in thinking about how racial disparities might be introduced into the coordinated entry system is to consider how people experiencing homelessness interact with the formal coordinated entry process after referral is made and when assessment begins. As a start, consider what initial requirements exist. Documentation requirements such as state-issued ID can pose a barrier to people experiencing homelessness generally, and that barrier can be amplified for people of color, especially those who are themselves undocumented immigrants. And does beginning the coordinated entry process require coming into an office? That requirement creates an additional burden on all people experiencing homelessness, who often don't have access to transportation. And again, because of historic and ongoing structural racism, including the situating of more robust public transit options in higher income and wider neighborhoods, that burden is only magnified for people of color. That in-office requirement can also be a transportation burden when it comes to completing assessment tools. And people of color may feel more or less comfortable answering assessment tool questions over the phone or online, and should be consulted when designing what the intake and assessment process looks like. But there are many other questions to consider when thinking about ensuring racially equitable assessment for housing interventions. While much attention has been focused on some communities that have found racially disparate outcomes in some scores for a particular assessment tool, it should be noted that other communities using the same tool have found no such outcomes, and some have even found that people of color scored higher on the same tool. This all points to the likelihood that it's not so much about any particular tool as it is about how tools are administered. To that end, important considerations for the assessment part of the coordinated entry process include thinking about who is administering the tool and how it is being administered. Research indicates that people feel more trusting and open completing assessments and surveys and interviews with people who look like them and share their cultural or life experiences. So COCs should ensure that staff who administer assessment tools are racially, ethnically, culturally, and experientially reflective of people experiencing homelessness in their communities. In addition to examining data about whether people of color are being assessed in proportion to their makeup of the homeless population, COCs should think about when, during the process, assessment tools are administered. For example, if that happens long before housing resources are ever likely to be available, people are just being assessed to sit on a long waiting list, and then they may or may not remain reachable when they come to the head of the queue. In some communities, data may show that people of color disproportionately fall off of waiting lists because they can no longer be reached. COCs should also consider what is being assessed with whatever tool they choose, and whether or not people of color are more likely to be over or underrepresented among people experiencing the factors being assessed. For example, because of historic and ongoing structural racism, African Americans are more likely to have been targeted by the criminal justice system. So if the barrier to stability of criminal justice involvement is a factor that is being assessed by a tool, African Americans might be more likely on average to endorse that factor. Finally, another consideration about the assessment process is just how long the tool is. As mentioned before, wherever burdens exist in the coordinated entry process, those burdens may be amplified for people of color experiencing homelessness. So lengthy, burdensome assessment processes should be simplified and streamlined for all people experiencing homelessness. The prioritization phase of the coordinated entry process is another place where COCs must be diligent about examining their data to determine whether disparities exist in who is getting assessed. If disproportionately fewer people of color are being assessed for housing, they will necessarily be disproportionately prioritized for housing. This phase is also one that demonstrates how thoughtful communities must be about which populations they are prioritizing for housing and how racial disparities in the larger society can affect the racial makeup of prioritized populations. For example, while communities can and should be prioritizing people with disabilities experiencing homelessness, particularly for permanent supportive housing, we also know that white people are more likely to have their disabilities officially certified due to historic and ongoing structural racism. So if the prioritization of people with disabilities does not include some mechanism for accounting for and ameliorating the disproportionate denial of disability certification to people of color, that disproportionality may in turn manifest itself in who gets prioritized for PSH. Another consideration during the prioritization phase is the amount of weight given to the score someone gets on the assessment tool. This consideration is really part of the examination of how the assessment tool is being administered, which was mentioned in the previous section, because we know that the variability of scores by race can be influenced by many factors, including who administers the tool and how it is administered. But while communities are working on ameliorating any disparities being created by administration of their assessment tools, they should also be considering during the prioritization phase how those disparate scores might create further disparities in prioritization for different housing interventions. The next phase of the coordinated entry process is the one in which people who have been assessed and prioritized are matched to housing interventions. Like the others, this phase is one in which data collection is really important to determine whether disparities exist and what might be causing them, including, as before, thinking about the racial makeup of the staff who are providing navigation services. Additionally, consider who makes those matching decisions. For example, is that being done by a committee? Who is on the committee? Are the members of that committee reflective of the racial, ethnic, cultural, and experiential makeup of people experiencing homelessness? Are members of the committee aware of how racial disparities might be perpetuated during the coordinated entry process and committed to ensuring racial equity in their matching decisions? Finally, good data is very important for determining which programs are denying matches for entry into housing programs and for what reasons, so that COCs can see if there are patterns of rejection for barriers which people of color are more likely to experience due to historic and ongoing structural racism. Where particular programs are determined to have a disparate racial impact during the matching phase, COCs can take steps to ensure those programs adopt more equitable criteria for entry. The enrollment phase of the coordinated entry process provides another opportunity for COCs to examine their data and do some deep thinking about who is getting enrolled in which housing programs and what those housing placements look like through a racial equity lens. COCs should be monitoring how long housing placements take as a matter of performance measurement, but they should also look at demographic data for that performance benchmark to determine if racial disparities exist and for which programs. If white people are getting housed faster, COCs should ensure that measures are taken in programs to ensure that housing placement and case management staff are racially, ethnically, culturally, and experientially reflective of people experiencing homelessness, and that all staff who influence housing placements are trained in cultural humility and responsiveness. Additionally, all staff should be aware of the barriers that historic and ongoing structural racism creates for people of color getting into housing, like lower credit scores or higher histories of arrest, and they should be trained to address those barriers when working on housing placement, including being mindful of racial and economic segregation in housing opportunities. And as mentioned during the matching phase section, where particular programs are determined to be having disparate outcomes by race during the enrollment phase, COCs can and should take steps to ensure those programs adopt the practices just mentioned to improve housing placement outcomes for people of color. Similarly, services that are provided in permanent housing placements from rapid rehousing to permanent supportive housing should also be structured through a racially and culturally aware and responsive lens to ensure that people of color in housing placements are able to maintain stability in those placements despite the additional barriers to stability that they have as a result of historic and ongoing structural racism, like landlord discrimination or disparate access to economic security, being living wage jobs, Social Security income, unemployment insurance, and social safety net programs. In conclusion, coordinated entry is an approach to homelessness that is necessary to shift our response from one that is project-centric and arbitrarily applied, often to people who were most likely to succeed in programs rather than to those who needed housing the most, to one that is person and community-centered and that ensures that those who are most vulnerable and have the greatest needs are able to access and are prioritized for scarce homelessness resources. While coordinated entry should not itself become a barrier to housing for people experiencing homelessness, it is a more complex process than just an assessment tool. So when COCs are examining their coordinated entry systems to ensure that they are not perpetuating racial disparities among people experiencing homelessness, they must consider the entire process, including all the questions highlighted in the simple flowchart developed by the Alliance and explained in this presentation. As mentioned previously, the flowchart and presentation do not cover all the possible ways that coordinated entry processes might have a disparate impact on people of color experiencing homelessness. But they are intended to provide a way for COCs to begin to visualize the process and where they should be mindful of the possibility of racial disparities becoming amplified during coordinated entry. Again, this kind of systemic thinking about potentially disparate consequences during coordinated entry processes is even more important during public health crises like the coronavirus pandemic, because racial disparities exist among both people experiencing homelessness, particularly African Americans and Native Americans, and among people contracting and dying from COVID-19. For African Americans and Native Americans experiencing homelessness, thinking about racial disparities during coordinated entry is doubly important now for ensuring that they have equitable access to the literally life-saving intervention of permanent housing, because their lives matter.